Hello and welcome. I'm Annette Reeder from the biblicalnutritionist.com. And today we're going to talk about how do doctors test for depression? This is very important because you may be surprised at what we're going to share with you. But we're not going to leave you there. We're also going to give you answers of where you can go if you think this is something that you're dealing with, but you're not sure. And we're going to give you some hope in this conversation. Well, today I am joined with my good friend, Dr. Jay Hitson. You've already met her on many of the other videos that we have done. She is the queen of understanding blood work and helping you to see what's going on that inside view just by getting your blood work done. So she's the queen of that. And it's always a joy to have her come and share with us. So before we get started, I just want to say thank you for letting me share with you God's recipe for excellent health. And that always includes teaching you how to just be confident in the kitchen, which is our fun cooking classes, confident with your health. This is what we're talking about today. But most importantly, confident in understanding how much God loves you. And he has loved you from the moment of conception. All right. Well, thanks for joining us. Be sure and hit like, subscribe, and the bell so you get notified. Now, Dr. J, welcome back to our video.
Oh, thank you so much for having me again.
Always, always, always a delight. And too bad we weren't in the same state. We could just be sipping a cup of tea and doing this interview together.
Maybe someday. I'll be making
Maybe.
a trip to the coast here soon. Go that direction.
All right, sounds good. All right, get us started. How do doctors test for depression?
So, sadly, to get a diagnosis of depression, it really is more of a questionnaire, which I think a lot of people would be surprised that it's just a series of symptoms. Those symptoms that you're presenting are you are the one telling your doctor. So essentially, to get a diagnosis with depression, it's just a matter of saying the right things to your doctor, and you can get labeled as depressed. There really are not a lot of uh, objective tests out there, like blood work, or we're just now starting to get into some brain scans and those types of things that can sense levels of depression and whatnot, but we're still very, very far away from that being a regular diagnostic criteria. They're still way too expensive and not nearly accurate enough for regular consumption in the healthcare industry. So right now, and for me, as somebody who has worked with thousands and thousands of people, how easy it can be to get diagnosed as depressed and to leave your doctor with a medication for this after a very short, sometimes even just 5-minute conversation. And one of the things that what used to be is where you to get that diagnosis, you used to have to see certain specialists, your psychiatrist, your psychologist, and whatnot. We're seeing a lot of primary care physicians. We're seeing a lot of just family doctors. We're seeing other specialists who are now diagnosing and prescribing for depression with a very, very simple and a little underwhelming evaluation.
And it's really sad that that's really the truth. Because if I were in charge, I would require that the doctor has to send that patient to a nutritionist because diet is one of the leading contributors of depression. And I know many women aren't willing to just like address the diet issue, but as a nutritionist, that's where I want to go first because we can so change that around quickly. And then the other thing that saddens me is that antidepressants are one of the number one pills that women are put on and that they take. For men, it's mostly statins, but for women, it's the antidepressants. And then that's going to lead us to part of our conversation coming up and how that leads directly to infertility. And it's quite a chain reaction, but I don't want to get ahead of us. So totally, I understand, checking 4 boxes and that's how you feel in the moment. But to take a medication for how you feel in the moment, and I get it. People are saying, no, it's not how I feel in the moment. I've felt this way for a long time. Yes, you have. You have. But yet, if we can change a few of the elements of your life and your lifestyle, we can start easing away from it. And I don't want to take away from the fact that some people are very seriously into depression. And I get that. But many people who are put on the medication just by checking four boxes, there are other ways that we could go about this. What do you say?
100%. And, one, there are those who, less severe cases, which now they're taking on a label. And that is something that's really important to me. You have to be very careful what labels you allow to be put on you. I am is very, very scriptural, very powerful. And so that is one where some people didn't even realize until they walk in, got this label, now they got this medication, and here we are 10 years later, still battling that. And then yes, there are some very, very severe cases, and 100%. Um, but still at the same time, and while medication sometimes is absolutely, and and I think that is something, a decision that everybody needs to make with their doctor. For those who are trying to avoid that route, and I know a lot of the people who are listening to us right now, they don't want to be on all these. They don't like the way they feel, and they don't even feel that they really worked that well for them. And that's a lot of the, probably a lot of the people that we're talking to right now. And you're listening, you're like, yeah, I'm on these, and I don't know that it's really working for me. There was a phenomenal study where this groundbreaking drug, they were just proclaiming how fantastic it was, and it was working with less than, just shy of 50%. It was groundbreaking. This is a miracle drug. It was working for less than 50%, and it wasn't even getting them 50% improvement. That's, to me, that's a little underwhelming. So one, for those who you don't want the medications, you want real answers. You want to get better, and you want to do it God's way.
I totally agree. I totally agree. And even those who are very serious and they're on the medication, we still need to work on the diet. So you still need to meet with your nutritionist and you still need to make some changes because then you're going to start see, and actually a good healthy diet actually makes medications work better so that you need less of a prescription. So if we don't address the diet, we're always going to be in a downward spiral. The pills are not going to help our digestive system to rebuild the microbiome so we can actually make the neurotransmitters to stop being as depressed. It's like, okay, but you still need to meet with me one way or another. You still need to meet with me. So, all right, what's
That's
next?
So, I mean, and so once, and the other thing that I do want to just point out is that there are also some of, while there are absolutely environmental factors, there's definitely mental, cognitive factors, there are a lot of medications out there that the side effect is depression, beta blockers, statins, corticosteroids, hormones. All of those things have this as a secondary depression. And, for the aging population, we have to look at the chicken and the egg here. Which one came first? And just being very aware. So then, as we're looking at that, now dialing back not just the depression symptoms, but why do we have to get on these medications to begin with? And working all of those different things back. And it really, while depression is definitely, in the mental health category, there's a lot of physiology, there's a lot of biochemistry, and there's a lot of things that need to be addressed, like what you're saying, with your diet, with your gut, with your gut microbiome, and just all the other factors that can be contributing to what are you doing? What is going on in your body that is creating these depression symptoms?
So agree. So what hope do you have to offer people?
So, first and foremost, it's so important to get a full complete panel done. And here is why. When you walk in to your physician's office and you say you have depression, you say you have anxiety, it's going to be extremely rare that they're going to order any kind of blood work. That is just not the standard of care, because depression, anxiety don't show up exactly. There's no diagnostic test in there. But here's the thing is, so many of the symptoms and different things that are going on within you, whenever you are severely anemic, the diet is not there, you're not absorbing your food. Severe anemias the body sends these distress signals. It feels like you feel like something's just wrong. But what is happening a lot of times now is people are labeling that as anxiety. They're labeling that as depression when it's actually something physiological going on. So, number one, let's just check that out. Let's make sure that there's nothing physiologically going on, which almost always there is. I've done a lot of these. I still have yet to have one person go through where there wasn't a physiological element to address. So, addressing all of these secondary things so that your body is healing and gets into a healing state that then allows you to get that momentum for the cognitive healing, for the mental healing as well. And a lot of the symptoms, fatigue and exhaustion that we associate with depression can have a lot of physiological. It really could be coming from something completely and totally different. And that's why we look at you as a whole person. We look at you from a biochemical level to find out what is really, really going wrong. And then from there, we break the secondary bonds. So we got to get you strong. We got to get you strong again. And it's a process. But one of the things that I have seen is that okay, so there can be a whole lot of things that can be causing the fatigue that we normally associate with depression. When you start to you battle and you start to overcome those things, well, now we've got a little bit more energy. We got more reserves to start to take on the last of the symptoms that even remain, which has just been really a beautiful process because the success rates for depression are not strong. There, if you just look at the overall population, you don't have to look far to see that a lot of people, once they go on these medications, they typically are not coming off. They're not getting better. So it has been so encouraging watching so many people making progress and getting their energy back and getting their joy back.
I so agree. And that's what I've noticed as well when I would teach in just different areas around the country is that people who are on antidepressants are actually afraid to get off because they say, Annette, you don't know what I was like before. And I'm not as good as where I want to be, but I'm not that bad. And so my answer is always, okay, let's do a food journal. Show me what you're eating, how you're feeling when you eat that way. And I actually wrote a specific journal, the Hunger Satisfied Journal, for this very purpose. What are you eating and how do you feel? But then from that, let's start changing your diet to more of a biblically based diet. And then over the next 6 months, let's just start changing also what you believe about yourself, which is what I coach in the inner circle. And then we can say, okay, let's look at it 6 months from now. How do you feel about the medication? Is it working as good? And typically what they will say is, I'm feeling so much better. I feel like I want to go to my doctor and see if he will lessen the dose. And this is where your relationship with your doctor is very important because I would never suggest that. But if the person is ready to ask their doctor to do that, then I would say, yeah, go talk to your doctor. Always work with your doctor with any medication. Anything that I'm going to suggest is never going to interfere with what your doctor is doing for you. But we may help your body to heal so that you no longer need the antidepressant. Another story was I was having a conversation with a gentleman recently, and I brought up the fact that about antidepressants, and he says, "Yeah, I've been on one for 6 years." He says, "But the reason I needed to be on it, that situation doesn't exist anymore, and I want to get off." And so this is a conversation we have to have with our doctor. But what I like what you're adding to the conversation is getting blood panels. You can actually see other contributing factors that have a side effect of depression. And so it's not first and foremost. And it's actually old school to just kind of separate the head from the rest of the body. And it's like, okay, 4 boxes checked, you now get an antidepressant. It's like, no, no, no. The gut, the vagus nerve, it all affects how your brain receives signals and how you respond to those signals. So let's pull this away and connect back again and see how the body can actually affect the depression and the antidepressant. So with myself, oh, I so needed a gut healing when I was probably 13, but I didn't realize it. And so I always battled with, I call them partly cloudy days. And then there were times when I was married that it was fully cloudy days. So it was like, okay, something's up. And I really, not until my husband and I went through that full transformation, starting with the Daniel fast and then understanding the value of specific vitamins, is I started having fully sunny days, full sun today. And I would just wake up as like, this is what I thought I should feel like, but I never knew I could experience it. And huge difference in my, as I say, my husband doesn't have to worry about what mood I'm in anymore, because he can feel free to walk around the house and do whatever he wants without being attacked. And he likes that. So,
No, and that's it. I mean, one of the things that we talk about a lot is to experience fullness of joy. You
mhm,
know, that's exactly what you're describing. Fullness of joy. It's not something that just happens. That's not something that just you just stumble into constant fullness of joy. There's a process, and there's a physiological component, there's a psychological component. All of those factors need to be met, and a soul component in order to feel that. And that's one of the things that I have noticed, that even those individuals who are doing the mental health side, but then they're not doing the physiology side, they're not doing the food, they don't get the fullness of the healing. And that's where a lot of my conviction, watching so many people just not getting better with the traditional routes with regards to depression, anxiety, and all of that. And it's got to change. It has got to change. We cannot have another generation inheriting this. It's become beyond like a generational curse. We cannot pass this down anymore. It needs to stop.
it does. All right. This has been so insightful. And I'm even preparing for a conference this week and that I'm speaking at. And I'm talking about infertility, and depression is one of those contributing factors to infertility, and especially if they are on antidepressants, it does add another element that we have to overcome. So this topic is near and dear to my heart, mostly, well, for one, because I have walked through the partly cloudy days, or my husband would say they were stormy days. So, but he likes the full sunny days today. So I just want to say, for those of you watching, there is hope, and God created our body to heal. If you're on a medication, please only work with your doctor and just see if it's possible that you could start working to maybe get off the medications. I don't know, but you and your doctor are going to conclude. But the underlying thing is we have to heal the gut. And that comes by just eating the foods that God called good. I teach about the three principles in the Treasures of Healthy Living Bible study. I work you through the just the belief factor. I talk more about that in the 40-day transformation course. Just a lot of materials on our Biblical Nutrition Academy that you can check out. But yet, just realize many people who have just decided, you know what, I know God has the answer and I'm going to seek Him first, because He does. He has the answer for you. And as you're saying, that abundant joy, like John 10:10 says, that's what's available in many aspects, physically, spiritually, and emotionally. So, Dr. J, any parting words before we end this call?
Oh, there's so much more out there than you realize, and it can be really difficult when you are dealing and battling in the throes of depression. That's one of the things. Motivation is a major issue, but we can take you one step at a time. Um, and that's one of the things. Like my philosophy is to build you up one piece at a time, one step at a time. So it doesn't have to be overwhelming, and it doesn't have to be this thing that you can't imagine getting out of. And that's one of the things that I've really loved working with people one on one. Being able to figure out what is going on and what is their simplest, most easy, most accessible roadmap to getting to them to where God intended them to be all along.
Exactly. All right. So the steps are: one, it helps to have a good exploratory blood panel done. And Dr. J will put a link to her program down below. You can check that out. That comes with the complete follow up with her. So you get to meet her. She gets to share with you what the results were. So understanding what's going on chemically in your body is going to give you an inside view that maybe something else is a contributing factor. And then meet with your nutritionist. Well, if it's me, then all my teachings in the courses and in the Bible study, you can check those out as well. And that's just changing every day to seeing food the way God created it. And then your body responds so well to that. And if you need more help, just put a comment in the comments down below. We'll try to follow up with you. And then I'm also going to put a link to the supplements that truly gave me that final breakthrough for the full sunny days. And they make a difference because they go in and they heal the microbiome. And that's where the healing has to begin. So sometimes you can do it with food, and sometimes you just need a boost to get started. And that's what they are. They're that boost to get you started so that you can start having more abundantly joyful days. All right, Dr. J, thanks again for another fabulous video to teach us more that we need to understand about the inside view with blood panels, and also how many symptoms and issues that we're dealing with, as I say, they're actually optional, but we have to be diligent to find the root cause and then do everything we can to heal that. So thanks for joining us again.
Thank you for having me.
All right. Well, thank you everyone for letting me share with you God's recipe for excellent health. It always includes the most important ingredient is God loves you and he has a purpose for your life. And he has loved you from the moment of conception. Thanks for watching.